Good evening, ladies and gentlemen. This is Newsbreak with me, Sanket Upadhyay. The heart of the matter is that post-COVID, there has been an alarming increase in heart attacks. And this is the heart of the matter. It is happening way too often, way too soon. It's getting recorded on CCTV cameras. It's happening while people are dancing, when they're celebrating. So this is the reality. Let's face it. But the big question is, what do we do with this? We know this as a fact, that this has increased, not just in India, all over the world. But what do you do? There could be a situation tomorrow that you are in a public function and then you encounter a situation like this. Then what can you do? Can you make some intervention that can be life-saving? So on this program, cardiac arrest, heart of the matter, what we want to say is, arm yourself with information. And we'll be speaking to two doctors who will tell us exactly what to do if we are caught in a situation like this. Also on the show, in just a short moment, we'll get you all the latest surprises that you must watch out for as the Northeast election result comes out tomorrow. What are the key surprises? Ratnadeep Chaudhary, our colleague, is going to tell us about each of these three states. What are those key surprise elements to watch out for? But first, let's quickly get you this presentation from Uma Sudhir, because many of these instances happened in Andhra Pradesh and Telangana, and she got us this report.
A pre-marriage haldi event at a home in Hyderabad's Kalapathar. There's merrymaking and laughter. The groom's brother-in-law, Mohammad Rabbani, reaches out to apply turmeric and suddenly collapses. At a gym in Hyderabad's Boinpalli, 24-year-old constable Vaidi Vishal was working out when he suddenly collapsed and died. Hyderabad Police Commissioner C.V. Anand told NDTV he was a fit and healthy young man with no history of substance abuse. This 19-year-old from Maharashtra had come to Nirmal in Telangana to participate in a marriage celebration. He was dancing and suddenly collapsed.
Sudden collapses are usually because of the arrhythmias, that is a rhythm disturbance. Heart suddenly starts beating at a very irregular, fast rate, and that arrhythmia is most of the time is responsible for a sudden collapse and where the heart stops. So out of hospital cardiac arrest can be saved by giving a shock which we call as a defibrillator, a defibrillation.
At Hyderabad's Aramghar Junction, 42-year-old Balu had just got off a bus and collapsed. Luckily for him, Constable Rajshekhar persistently performed cardiopulmonary resuscitation or CPR, a life-saving procedure, and saved his life.
CPR is a procedure and it's a skill which we believe at this time every citizen globally should learn this. This is not something which is region or in India or anything. Cardiopulmonary resuscitation at this time needs to be taught to everybody.
I recommend that every school, every college, every software engineer, software guys, they should learn all this, because help doesn't come in just a second. So we need to do that and we can save many patients.
आपके ये हथेली उसके छाती के लोअर बोन पे रहना चाहिए. ये बोन, बीच का बोन, स्टेरनम बोन बोलते हैं, इधर हाथ रखना चाहिए और दूसरा हाथ उसके हाथ के ऊपर और स्टार्ट कंप्रेशन, और कंप्रेशन करना शुरू करना है.
Life-saving procedure, something which looks fairly simple, but something for which you must get yourself trained so you're equipped with both the confidence and the ability to be able to perform and save a life. In Hyderabad, with camera person Nagaraju, Masudhi, NDTV.
So as you saw in this presentation, this is not just the story of Telangana. This is not the story of Delhi or all the other states. It's happening all over the country, it's happening all over the world, and doctors say that this is the right time for all of us to change into lifesavers. How can we do that? Remember, don't shrug this story off as if it is not important. This can happen in your life too, while you are in a function. So what can you do in a situation like this? Let's arm ourselves with information. Dr. Sameer Gupta is the Director of Interventional Cardiology, Metro Group of Hospitals. We also have Rajneesh Kapoor, Vice Chairman of Interventional Cardiology at the Medanta Hospital. Thank you very much, Dr. Gupta. I want to begin with you first. Let's imagine that there is a situation, hypothetical. It's not so hypothetical these days, but still. If there were to be a cardiac arrest case as we speak right now, what can a layman or people gathered there do apart from calling medical help?
I think, Sanket, first of all, let me congratulate you on taking this very important topic. I know normally everybody talks about let's try and prevent heart disease, why is this happening? But today we're actually looking at something like what do you do in terms of an emergency? Now, when somebody collapses in front of you, right, if somebody faints, the first and foremost thing you do is you call for help, right? You call your friend, you call your ambulance, you call somebody for help, and the next thing you do is you go and see if the person is conscious. You basically start the CPR protocol, if I was to say that. CPR stands for cardiopulmonary resuscitation. Cardio means heart, pulmonary means lungs, and resuscitation means do the work of the heart and lungs, because we would take it that the person is not breathing, he's basically lying dead. You check the pulse. If there is no pulse, if the person is unconscious, not responding, you check a pulse. You can check the pulse in the neck. You can check a pulse in the arm, at the wrist, called the radial pulse or the carotid pulse. And if there's no pulse, the person is not breathing, he's unconscious, you have to start CPR, where you take your hands and you put it on the chest. Like you showed in that video, there's a particular protocol to do that, to basically do the work of the heart, because the heart, in a sense, is not beating, and the person is dead. So you start CPR.
Okay. Rajneesh Kapoor, what will your advice be? First of all, do you feel that there has to be a massive familiarity drive? For instance, take a look at this footage. Just a short while ago, we saw a man collapsing in a gym. Now, many of these incidents are happening in the gym when, a person's body is pumped up, you are doing heavy exercise, or when you're playing a sport, like in this case at the badminton court. And we see that a lot of people are standing there. Now, instead of standing and waiting for the medical help to arrive, see, you can't expect a cop who is trained to perform CPR to be available everywhere. Then?
Yeah. So thanks, Saket. I'm absolutely pleased that this topic is raised and we are raising the pitch so that awareness should reach everyone. We have tried a lot to give all the lectures of CPRs in all public forums, but still this is the best medium. So if I give you a data, very small line, that 60 to 80% of sudden cardiac arrests are actually witnessed by somebody. But then only 10% of these cardiac arrests are given appropriate resuscitative measures. So 70% or 80% of cardiac arrests which are witnessed, nobody is not doing anything. So this is a huge statement actually. So like your pictures are showing that there are persons surrounding the victim, but nobody is coming forward. So rules are very simple. I think it has been already talked about that CPR, like this person in your picture is giving a CPR. So I think this is a life-saving modality, life-saving technique, which can actually salvage a life. So one should start the CPR immediately after noticing, as Dr. Sameer just mentioned, you should check out the pulse and the breathing just
but Mr. Kapoor,
at the nostrils.
Mr. Kapoor, if I may, you see, not everybody is qualified or trained to be able to perform a CPR. I may have the best of intentions, but if I don't perform it properly or I press a bit too hard, if I do not ensure that a person is well seated or the clothes are, where exactly to perform, how much pressure to put.
So we
That's
can,
a
we can
huge
all
concern.
talk about. Yes, it is. It is. So one, after established, the patient has collapsed, somebody has collapsed, you check out on pulse, there is no pulse, and nostrils, there is no breathing. Your immediate next step should be put the patient on a hard surface, be it floor is preferable. Put the patient on floor and then get on the top of the patient like this and get your fists interlaced. So then start pressing on the mid of the sternum. The force should be quite considerable. So don't worry about the force, because if it is not done forcefully, this is an inadequate CPR. It has to be appropriate, precise CPR, and it should be a good force.
Even at the risk of breaking someone's ribs.
Absolutely. So normally it is said that a good CPR is the CPR where some ribs get fractured. So don't worry, we are losing a life. If at all it can be salvaged, it has to be with a proper good downward force over the chest. Now this is, if you compare it with dummy is a plastic. Now the person's rib cage is quite resistive to the force applied. So you have to press it down so that it goes at least 3 centimeters down. It has to be forceful. And don't worry about fracturing the ribs, even if the ribs are fractured, but we salvage or patient
save a life.
Person starts breathing. I think that's the best part, at least we are saving a life.
That's a very
fractured
important
ribs can.
Yeah, Dr. Kapoor, that's a very important point that you're making. Dr. Gupta, now let's come to who can perform this CPR exercise. You see, a proper training is required. We've known the process. Do you feel that right now there should be, perhaps efforts in schools and colleges at every level to churn out more and more people who can perform this? Instead of just providing this training, skilled training to just, relief operation like, for instance, the NDRF team or the police or the cops.
I think that's
you feel it should be done at the college level, at the school level?
I think this is an activity which is there for the community. I think everybody, every citizen, every human, if I was to say that, should know CPR, because whenever somebody is using it, like Dr. Kapoor said, 60 to 80% of these events are witnessed events. And when you're going to witness it, you're going to witness it at your workplace, at your home, in a bus, in an airplane. So, you'll be in an environment where you will witness it, and you'll probably be surrounded by people you know. So everybody should learn CPR, and to make it for a community, I think it has to be taught in different levels, right? I mean, right from school. In many countries across Europe, CPR is a training which is started for senior students. 9th, 10th, 11th, 12th class students, they start learning CPR. It should be taught in corporate offices. It should be taught in in various like the police and the first responders. So I have personally gone and taught CPR to CRPF commandos. So, I think it's an essential thing. Everybody should learn it. And there is no wrong CPR, right? I mean, people will say, you know what, I don't want to do CPR on this person because I don't know the correct way. Well, do whatever you can. Don't stop for the sake of not knowing how to do it. Do whatever you can. At least give it a shot. It may work. What you may think is not right, maybe it is right. Yeah. So please go ahead and do CPR. If the person is unconscious, doesn't have a pulse, is not breathing, that person should get CPR. And like Dr. Kapoor said, don't worry about the ribs. Don't worry about anything. We will deal with the broken ribs at a later date. The person has to be alive for the ribs to heal.
And do you feel, Dr. Kapoor, that this is the criminal delay in that initial period is what is the difference between life and death? How many minutes does one have?
So we need to understand one thing very clearly. If the person has collapsed like this, it's a matter of only 2 to 3 minutes. See what happens, your person's heart has totally stopped. There is no circulation happening in the body, and the brain is the most sensitive organ. If brain gets depleted of blood flow, it gets totally irreversibly damaged within 3 minutes. So whatever the best time is, that first 3 minutes. If somebody is proactive and gets the things going in terms of it starts the CPR, and now CPR is helping to maintain that blood flow to the brain. And in the meantime, now somebody has started CPR. It's not likely that the response will come in all the patients in next few minutes. It may not be. It may be a exhaustive thing for the person. So if somebody has started CPR, he should continue as much as he can and then look for help. If another guy, he should call that now you do, and side by side, there are other things to be done. If the patient is waking up, like in one of your figures, the patient gets conscious. So that is a best thing, best outcome scenario. But in other cases, call for ambulance and look for help who can change hands, because it's going to be a fatiguing event for one who is doing it after 5 minutes. But then it is also said very clearly that we should not stop CPR for 15 to 20 minutes before really calling it off if the person is not waking up. Still, somebody has a chance. We have done very aggressive CPRs and got the life back even after 20 to 25 minutes of CPR. One more thing which I would like to add, I'm not sure whether I'll get time beyond this. Now, AEDs. AEDs are very small devices, automated external defibrillators. All public places, it should be a norm that they should be equipped with AEDs, whether it is cinema halls, whether all airports. Now I see that airports are equipped with AEDs. All schools should be equipped with AEDs too. Now, if somebody starts a CPR and AED is available in the vicinity, the next step is one should deliver the shock over the chest. Now, all these things are not very complex. They are pretty simple and pretty simple to use. If all schools make a norm that there should be lectures of CPR given by doctors to all classes, why not? It's a very simple thing.
I think these are
now
really valuable suggestion. Thank you very much. I've run out of time, Dr. Kapoor as well as Dr. Gupta. But with the promise to return and continue to highlight this issue over and over again till such time that people do feel the need to learn CPR training and learn the process of a CPR themselves, because this can be life-saving. A person who suffers a heart attack only has those 3 minutes, as Dr. Kapoor just mentioned. Every individual can be a lifesaver, as these doctors are saying. Think about it very, very seriously. It is happening more frequently, and the chances are very high that it could happen around you as well. Thank you very much, Dr. Kapoor as well as Dr. Gupta.